evening, and welcome to Black Mental Health is Black Health. So glad you can join us tonight. Hopefully, everything shows. In the last few weeks, we have had more than our share of technical difficulties. I think I have them worked out. I hope I have them worked out. So we'll just see in a few minutes if things are live and well. Tonight we do have a guest who I'll introduce in just a moment, Dr. Elisa Brown-Pruett, a lifelong friend. I won't say how many years we've known each other because those numbers are too big, but it's been a lifetime. So, as I want, looks like everything is working. I'm checking, and I'm so excited to say I think I've gotten the bugs out. So, as always, I want to start with some deep breaths. For those of you who have never been with us before, I'll remind you and let you know that we do the deep breathing because it allows us to decompress, get rid of some of the stress of the day. And I encourage you throughout your day, whenever you're feeling stressed, to take a few deep breaths that we're going to practice now. So, here is what I want you to do if you've never done this with us. Put your hands lightly on your stomach. And when I say breathe in, I want you to inhale. When I say breathe out, you'll exhale. And I'm going to count slowly to 4, and you're going to breathe in and breathe out slowly. So let's practice. Breathe in, 2, 3, 4. Out, 2, 3, 4. In, 2, 3, 4. Out, 2, 3, 4. One more. In, 2, 3. Good evening. 4. And 1 out. 2, 3, 4. So that's something you can do throughout your day. If you're just maybe feeling a little stressed, you can take a few deep breaths. What I forgot to say is the reason I had you put your hands on your stomach, I want you to breathe in so deeply that you feel your stomach expanding. That means you're taking air, just not breathing right here, but it's going and filling up your lungs, and you're going to feel it and taking in that deep air. It goes in your brain, it goes throughout your body, and we'll ask our doctor to verify this, how the deep breaths can be beneficial once we get started. Well, when we think about healthcare and African Americans, a lot of stuff comes to mind. We're diagnosed later with things. We have a poor prognosis. We get treated worse by the medical profession. All of these things come to mind, and they're not good. So tonight, we're joined by Dr. Elisa Brown-Pruett, and she's going to help us address some of these issues and look at historically some things, how we've been treated. During COVID, African Americans got a bad rap during COVID. Oh, we had COVID and we suffered worse because of us. It was our problem, not anybody else's but us. We ate wrong. We did this. So that's why we died at great rates. It's more to it than that. And we'll look at that. There are just some disparities in our society that impact our health. So we're going to look at that tonight, because so often as African Americans, we're blamed for the disparities in healthcare. It's not just that. It's so much deeper than that. And that's why we have our guest here tonight. And before I introduce her and let her introduce herself, if you're on Facebook right now, share this so others can glean from this good information we're going to get tonight. Elisa Brown-Pruett, as I said, is a lifelong friend. And I like to let my guest introduce himself. So Dr. Pruett, see, I've known her before she was married, so we remember the initial names. So Dr. Brown-Pruett, tell us a little about yourself and what made you even want to come on and talk about this topic.
Well, I'm an obstetrician gynecologist, and I am on faculty at Texas Tech University Health Sciences Center in the Permian Basin. So that's Midland and Odessa, way out in West Texas. And I teach medical students and residents as well as see patients, deliver babies, do hysterectomies, all those OBGYN things. And so, it's really important that someone who teaches adults and teaches future clinicians that we understand the history and the impact of biases in the medical profession and try to eliminate them so that we can proceed with excellence and humanity in the way that we approach our patients. So it's because I feel that we need to do a better job of teaching and understanding, each other as human beings, particularly as clinicians, that I am not hesitant to talk about this subject. I know it's always the person of color who does all the DIE talk, but um, I've got a particular mission with this because of the teaching.
Awesome. Well, you will be teaching us tonight. So, let's get started. I understand, and we all know that there is so much that African Americans deal with today that is entrenched in systemic racism, which is born out of slavery. It's here, unfortunately, to stay. We hope it disappears and changes, but right now it's here. What can you say about the relationship between slavery and the way African Americans are even viewed today in the medical field? Are there leftovers from slavery that impact us today?
Well, there's a beautiful interview that I just recently saw of Dr. Martin Luther King, and the journalist, who was white. Of course, this is maybe about a little over 6 months before he was assassinated. He asked him, "Do you think that this racism is going to go on forever?" And what is it? What is going on with white people that we can't get rid of this? Very prescient type of question, because it's still so pertinent today. But anyway, as usual, he was so eloquent, and he said, when you are going to enslave people and you rob them of their freedom and use them to build wealth, um, what you're doing is unethical and inhumane. So, in order to be able to continue to do this in your mind and in your conscience as another human being, you're going to have to dehumanize these people. And so, I think that the dehumanization of enslaved peoples is the thread, the making less than, the apology and excuse for slavery, and now for structural racism. It comes from slavery and having to make an apology for it. And now I think there is also a lot of fear of reprisal and guilt and all of those type of things that are mixed in, because that type of a pattern of behavior is traumatic for all those involved, and soul killing for all those involved. So you have this, a community that is oppressed and trying to deal with being second class and dehumanized, and what, 3/5, of a human being. Was it 3/5 or 4/5? um, and
Three
it,
things.
3/5, that the founding fathers deemed as. I mean, it's written in our founding documents, for God's sake. That's where I think it comes from, and it filters, of course, into our everyday life, and that includes healthcare.
Looking historically, what are some things that you can tell us about historically and how we were treated, such as, our skin is thicker, we don't feel pain. Can you talk about, was that really the way it has been in the medical profession?
Oh yeah, there was quite a bit of experimentation on black bodies during slavery, And there are some very well known examples. One of them in particular is the story of John Brown. He was a slave in Georgia, and there was a doctor who was actually one of the trustees of the Medical Academy of Georgia. And he uh, had this idea that Black people have thicker skin, again, dehumanizing, that we felt less pain, and that we didn't have the feelings of whites. And he was also a plantation owner in addition to being a doctor. And so he had this slave, John Brown, and he tortured this enslaved man and created blisters on his body and skin with burns in an effort to prove that Black skin went deeper than white skin, and that it was physiologic that we, as Black enslaved people, felt less than whites. And this is John Brown's words in a recounting of the story that was in his own words, but recounted by a British abolitionist. And John Brown said this Dr. Hamilton applied blisters to my hands, legs, and feet, which bear the scars to this day. He continued until he drew up the dark skin from between the upper and the under one. He used to blister me at intervals of about 2 weeks. This went on for 9 months. Brown wrote, until the doctor's experiments had so reduced me that I was useless in the field. And the issue with that is that still to this day, there are recent studies that show that many doctors, medical students, medical people do not believe that Blacks feel pain or feel it the same way that whites do.
And
It's
so you find that true even today.
as a matter of fact, there's racial bias in pain treatment and assessment. There have been several studies there from the 80s until more recently in the 2010s. There's a study from 2016 that showed that there were false beliefs about the differences between Blacks and whites in pain, and that people who came into the emergency department with the same problem, like say they broke their femur, the largest bone in the body, you can imagine the pain. And the Blacks were 30% more likely to not even be treated with for the pain, period. And certainly not strong enough medication. This is a 2016 study.
Mm.
There was a recent study, I believe this one was 2019, that found that nearly half of first and second year medical students believe that Black people have thicker skin than white people, and perceive that Black people are experiencing less pain than white people. This is my students who are coming to me now. And then some of those emergency department studies have been repeated up until right before COVID, and are still saying the same things, showing the
Mm.
same things.
Is this prevalent with non white doctors or Black doctors feeling this? This is it's an idea out there, and we're assuming it's only whites or others having these same perceptions about Black people.
Well, the two studies that I mentioned did not really break down so much the ethnicity of the doctors,
Mm-hmm.
but the majority of the doctors were white. Um, but the patient-to-patient interactions weren't really broken down.
Mm-hmm.
But the representation is so low. We've got single-digit representation in terms of at least Black doctors, um, and maybe a little bit more in the Latino community, but it's a very low representation.
Mm-hmm.
So I think that the correlation is that the majority of the people seeing these patients are going to be white physicians.
Right. Because it's hard to find an African American doctor.
Well, yeah, the representation is low.
And I'm sure in West Texas it's very low.
I'm often it in the room. So,
Yeah, it's not a lot of us in West Texas, period.
yeah.
That's a, but wow, for those of us who are out there,
Hmm.
it's very difficult. And we're going to come back to that, but I want to ask you, what kind of statistics can you talk about with real numbers of, we looked at the past and understand even how we came to be treated differently and that it hasn't changed. But what about now? Are there any data to show that disparities really exist? I know we talked about the perception, such as with the skin being thicker, but are there any studies about numbers you can share with us about disparities?
Well, looking at outcomes,
Mhm.
and mostly because I'm a gynecologist, most of the statistics that I have studied are going to be about women.
Sure.
But blacks are way more likely to die of heart disease than whites. If it's a black woman, it's 22% more likely to die from heart disease than a white woman, 71% more likely to die from cervical cancer, and 243% more likely to die from pregnancy and childbirth related causes. So we've all been hearing a lot about the maternal mortality disparity in the United States. And it's 2 to 3 times the rate of whites, and in Texas, 4 times.
Wow. Can you give us any idea on why you think that is?
Well, that goes to it's a multi-factorial issue, but the structural racism that was built into our country's laws, like redlining. We always think of Roosevelt as being the New Deal president, and then the neocons come in. With Reagan, they're a little bit before Reagan. They're really started with kind of like the Nixon era, but these guys came in and wanted to roll back all of Roosevelt. We always think of him, and especially Eleanor Roosevelt, as the one who had Marian Anderson come sing, yada, yada, yada. Well, pie in the sky, because redlining and purposeful discrimination was written into the housing laws,
Mm.
such that blacks could not get into certain neighborhoods and had to be confined to certain neighborhoods. So ghettoization basically antedates the 60s when we start and 70s when we start seeing these black pain movies, what I call black pain movies. So that was written into our laws.
Mhm.
The same thing where we just give us just a little crack of light and we bust the door open. That's what I call Reconstruction, where we had actually more representation in Congress than we do now. And, whites were not having it. So a lot of the Jim Crow and the massacres, like in Tulsa, Rosewood, those type of things, were in direct backlash to blacks, just taking that little bit of freedom and then just prospering. So when you look at those things, there is definitely an affirmative action towards white privilege. I mean, just to use the raw language. And so that leaves people of color, and most particularly Black people of color, out in the cold in terms of equity when it comes to healthcare, housing, clean air, clean water, all those basics from health. And even grocery stores. There was one grocery store in Buffalo. Okay, this is in the last couple of weeks, people. This is not 1920. Okay, and so there was one grocery store in that store where these old people could go, and now that store is closed as a result of that mass shooting. So with these kind of jealousies or kind of wanting to maintain white supremacy, structural uh, oppression was built into our system. And of course, naturally, that's going to affect health. It's not just a matter of access to care, it's even being able to find a safe neighborhood where you can walk and exercise, or a grocery store that is going to have, a variety of foods. And I'm not even going to say healthy food, because I'm just not into the whole patient blaming and why are you
Mm.
eating macaroni and cheese when you should be having a kale salad. Well, macaroni and cheese costs less than a head of kale, people. And kale is nasty. I'm sorry. I know that's probably up for debate, but it
It's
tastes like
personal
grass.
opinion. Some of us like it mixed
I
in.
hate it. I have tried. Don't put that in my smoothie. But anyway, there's a whole lot of moralization too, which this is again that apologizing and patient blaming is just one more way of excusing and apologizing for oppression. Well, you're fat because you eat Cheetos instead of kale, or because you don't walk, or because you eat fast food, and that's why you have diabetes. That's why you have COVID. It's a deep multifactorial issue of why there is such disparity, and it also goes to pregnant moms. And there have been more recent studies that show that there's a physiologic cost to this oppression in terms of it increased fight or flight reaction with increased adrenaline, which causes your vessels to clamp down, what we call vasoconstriction, and raises blood pressure. The indignities and stress of living in a world that has structural oppression is not just a bunch of people talking PC social justice warrior, which is a label I wear proudly. It has physiologic consequences that make it difficult. Also, the violence in our communities that is a result of structural oppression. One of the top causes of death, maternal mortality, um, is homicide. Homicide. So
So much there, so much there. When we look at and think about, just as you say, this things that are part of our society that have been set up for so long. Not that it's impossible to change; anything can change. But yes, it is. It's just systemic, and we do get blamed for it. We get blamed that again we're not eating healthy, we're not doing this when the options aren't there for us. So true. I kind of wanted to look at if there is a benefit to having a black doctor if you're black. And let me give you an example in the mental health profession. Um, for black women, hair is a thing, whether it's long, whether it's short. And if you watch my show, one week it might be this, the next minute it might be short, and it's whatever I'm feeling. And we just so many issues are around hair. So there was a black woman who was, seeking therapy, and one of her issues was depression, but she was initially talking to a white therapist. And one of the things she was depressed about was how she was being treated at work around her hair. Well, the white person couldn't get it, didn't understand why was this an issue. And she did, find a culturally competent therapist, someone who could understand how culture plays a big part in our mental health, just that whole being black. It was, and she was really feeling persecuted about it because her hair wasn't straight, her hair wasn't this and that. And so she felt she was being treated differently. Well, that was part of her culture, that was part of who she was, and it was real. Within the medical side of health, are there, how do you think that plays into it? I think there was a study about babies and doctors. I don't know.
yeah, in the pre show we talked about that a little. That there's a study that came out. I want to say it might have come out 2020, although the data collection was probably before that. But there's a study that showed that neonates, newly born kids, that had problems like prematurity, actually, um, the ones of color survived better if their doctors were um, people of color, particularly black. So yeah, there is some research to show that people do better. So if they have some kind of cultural connection, they really didn't go so much into the physiology or of it, or whether there were treatment differences. Um,
Mm. It
so
was just raw data collection. That,
right, and there's so many potential factors there, like
mhm.
even being able to relate to the parents and their interaction with their neonate being potentially different because they are given better instructions or instructions that they can understand better. Who knows? I mean,
Mhm.
I don't think, I mean, I can't imagine that it's only just because, the white doctors didn't touch the babies with as much gentleness, or there could be that, but I think that there are multiple uh, reasons or variables there. But the overall study did show that those babies did better with black doctors.
What about on your end as a gynecologist? And as we said, you're it when it comes to, you may be the only black doctor in the room, so you can't see everybody. What do you see, or any examples with adult patients or in your world where you've seen, yeah, it's a difference, or how patients
Well,
are treated?
West Texas is highly
Latina?
Latina, and I can definitely attest to when we have patients whose first language is Spanish, and they are able to talk with a nurse or a doctor who speaks Spanish. Their understanding of their condition and their options, and their part in their health is just much clearer, and it's easier to achieve compliance, which is, I think, is another kind of moral buzzword that we use in medicine that has a lot of patient blaming around it. But I think it's easier for them to follow instructions, come back when they're supposed to, take medications that, in the way that they were prescribed, things like that. So I
Mhm.
certainly see that. This community does not have a lot of black people, but I do feel that, I've seen in my own practice that there are certain cultural things that I can cue into with my patients that no one has ever asked them about, and there are certain diagnoses that I can arrive at sooner or in general when they weren't arrived at before, just because I have um, you know a cultural connection with that patient. So I've definitely seen it anecdotally in my practice.
Mm-hmm. What what are some things we can do when looking for a doctor? Let's say you're in a position where you can't find a person of color for your doctor, and you really want to because you want that connection. What are some things we could even look for in a doctor? To know that to feel more comfortable that that person's going to treat us appropriately.
Well, I think, first and foremost, before even the color of the person, is, are you being listened to? You
Mm-hmm.
know, do you feel that your concerns are being addressed? I do, I know that everything is monetized in medicine now, and, and productivity and 15-minute visits, and, the stories about patients being told that they can only have one problem per visit. Um, but there are still clinicians who are able to make any of those visits meaningful and have the person feel that their concerns are being heard,
Mm-hmm.
and that they are not being subject to bias, um, because of their color, because of their weight, because of their educational level, because of their background, if they've taken drugs in the past. Is that going to be a doctor, nurse practitioner, PA who's going to meet you where you are and take care of you? I think that's the primary thing.
Mm-hmm.
And then if you have concerns that you want somebody that you feel culturally, you have a connection with, I think the best thing to do in the community is ask around to other people. So,
And I know for some it can be difficult just because you have the barrier of insurance. You've got to get to, if you have insurance, you have to get somebody on your own plan. If you don't have insurance, then your access to health care can be pretty limited. Just inherently, sometimes I know when I was looking for, and I wanted an African American female doctor. Found one, great, love it. Then left that job, didn't have that insurance, and then when I got it, couldn't find that doctor again. And then the doctor I have now is an African American female, and I found her. I had gone through all the things you would look at, went through my insurance, went through all this. I found her. We were both speaking at an event, and that is how I found. So I found mine just um, happenstance, but it can be challenging. Even going through, you can go online, go to health grades, do this. You can go to your insurance. Some insurance carriers will allow you to, on their various websites, to search by distance, by gender, by ethnicity, and then you call and you can't find anybody. Because they're not taking patients. So just inherently, it can be a difficult thing to say, I want this care.
Yeah, it's difficult because the representation is not as robust as it should be too. So
Hmm. Like as you said, it's just not a lot there. So we're dipping in a smaller pool.
right.
I wanted to go back historically, and I want to talk about some of the things historically that have happened to us in the medical profession and look at it. And I'll bring up some things, but so we can see in some ways we're not that far from where we have been, and they're real, to put it out there, but then say we still have to go. So there were a lot of issues with women's health, and I know there were some things around forced sterilization historically, not just one or two times. Could you talk a little about that?
Well, there's been a tragic history of experimentation on women of color in the United States. Since slavery times, there's the famous James Marion Sims, who's considered the father of gynecology. Just atrocious, barn busting, unethical, inhumane person who experimented on black women without anesthesia, operations, and certainly not consent. Well, and they were considered property. And then there is the, immortal life of Henrietta Lacks, and she had cervical cancer, and they used her cells, without permission. Still to this day, that cell line still exists. But there's just a weird history in the United States of eugenics, and a lot of people, there were eugenics programs trying to get perfect human beings, which definitely meant nobody disabled, nobody of color. And they started in the 1800s to the 1980s with sterilization of people that were labeled as imbeciles or low intelligence. And so actually the Nazis got their eugenics idea from us. And so there were programs that started to try to sterilize people who were disabled, people who were of color, people of color being um, improperly labeled also as mentally disabled. And so there was these terms called like a Mississippi appendectomy, which were secret, unconsented sterilizations of black women in the U.S. South. In Puerto Rico, from the 50s up until the 70s, birth control pills that we take today, we didn't have those FDA rules, ethical rules about experimentation. Those pills were the trials were done in Puerto Rico, unconsented on Puerto Rican women, and also unconsented hysterectomies were done just rampantly, particularly on women of color, and particularly in the South, and also to indigenous people. There at one point, there at least a quarter of indigenous women were sterilized between the 60s to the 80s. A quarter of indigenous women. And the heyday being during the boarding school era, where they would just rip the kids out of their parents' arms and send them to these boarding schools. More recently, there were unconsented hysterectomies among immigration detainees in Georgia. This was a pretty big story in the news. And women were having these parts of their reproductive organs removed without consent. And one of the detainees, who was East African, was set to testify, and they tried to shuttle her away and deport her quickly. And Representative Sheila Jackson Lee stopped the airplane at the airport in Houston because she was transported, clandestinely to Houston to be deported. And she and her staff found this out and got that deportation halted so that she could testify. So this stuff still goes on. The reason, if a woman wants a sterilization procedure, this is something, with Roe versus Wade coming up, we're thinking again about reproductive rights. But for women of color, it's the other way around, that we may be robbed of our reproductive right to have children. Even during the Clinton era, welfare or aid to families with dependent children, and also EBT, or the food stamp program, was tied to work. And if the person didn't find work that was suitable um, to the program, their kids could starve. So this is the 90s. This is the Clinton 90s. So these things are still going on.
Yeah. As much as things are, we think they change, they stay the same. Especially when it comes to our healthcare, and the racism, systemic racism is alive and well and growing strong. I wanted to touch, we have a few minutes left. One of the things we hear a lot in our community is dealing with our weight. And some of, we look at BMI, and the studies that I've seen and articles that I've read lately talk about, we look at the BMI of your BMI is body mass index is a certain thing, you're this and that. Was just reading an article today about, again, another article about the way it's calculated and how it may be different for African Americans. Can you, I know we hadn't talked about that, but is there something you can um, share with us about what BMI means?
Well, weight has is another one of those things that is very multifactorial, particularly in the West and particularly in the United States, as a buzzword for health or a stand-in for health, without there being evidence to support that. You may have the fact that there are correlations between obesity, or what we term obesity by the BMI, and diabetes and blood pressure, but causation has never been established. And so there's a shady history of not only how the BMI was created, it was created by a European doctor who was trying to find a way to compare uh, average white males in Europe. Wasn't really meant to say whether or not anybody was fat or thin. And then, as it became popular to use in the United States, the insurance companies started using these tables in order to try to predict, to predict health when there wasn't medical evidence that it could predict health, the BMI. And oh my God, there's so much around that. So the BMI was actually lowered in the 90s in response to pharmaceutical lobby, because they had weight loss drugs in the pipeline. So even the upper end of what is considered overweight changed in the 90s. And this precipitated the obesity epidemic. So it's a little bit shady how we have since been using the BMI. The American Medical Association um, voted overwhelmingly to um, classify obesity as a disease in itself, but they sent a team of an ad hoc team of researchers and doctors out to gather the evidence of whether or not obesity should be considered um, a disease, and they came back and they said no, it doesn't have the criteria. It doesn't meet the criteria. We can't find exact causes. We can't find exact causal links, correlation, but not causal links between other diseases. It doesn't meet the criteria as a disease. But again, um, I think that a lot of these doctors, it wasn't just a monetary thing. I know that there were influences by big pharma, but mostly I think they just thought, well, we're going to be helping people if we kind of try to get them to be thin. Now, the other thing that's difficult is the diet culture that we have is largely racist, and being thin and petite and white is a power code among women who are already oppressed in one sense. But you can be right up next to that white man if you are petite and thin and white. And so, weight stigma for Black women and African bodies that are shaped differently than white European bodies is a way of othering Black people, particularly women. So there is the aesthetic part of it that has a lot of racial overtones to it, but there's also the science part of it that's a little shady. So I think as clinicians, we just have to be very, very careful in swallowing that whole pill and kind of like tease it out and apply what the patient needs as an individual.
Something we have a question, and I was going to answer this too. That one of the things we were told that is that Black people have a muscle mass different from whites, and that is Black people have muscle mass and white people have blubber, is what the person says, and that's why they're better swimmers. And if muscle mass outweighs the blubber, wouldn't our BMI be different, or is our muscle mass any different?
I don't think so. Not
And
that
that's
I have
something that
read.
we hear. Yeah, I mean, I see that in, I guess maybe more in pop culture or just,
Yeah,
in different
that's
ways.
pop culture because I got plenty blubber.
But that is
Yeah,
something that, is
that's a
perpetuated.
bit. It sounds a bit mythological to me, but I would have to do the research and get back to you on that. But that's not something I learned in medical school or anything like that. That the
Mhm.
composition of the bodies was um, really histologically different.
And maybe part of that is the same old racism that our skin
I
is
think
thicker.
so. I think that's like,
That,
oh, we got an extra bone. That's why we can dance.
yeah,
That's what it kind of sounds like to me. So,
yeah, wow. So we are so close to being out of time, and um, I told you we'd run out of time before we had information because trust me, audience, we have tons more information. So that just means in a couple of months you'll have to come back.
oh, I'd love to.
But we always like to end on a positive note with some suggestions called our call to action. And point number one would be find a doctor you can trust to go to that doctor. Take care of your health, but find one you can trust. Just like with our mental health, we talk about being culturally competent. You want your medical doctor to be culturally competent. And by that, I mean they understand and take into account your culture. Like I was talking about with the person who didn't understand, the white therapist who didn't understand why hair issues was causing a Black woman to be depressed because of her treatment on her job, or the same doctor who may feel that your skin is thicker. So a culturally competent doctor is going to see who you for who you are and take as much, if they're not of the same, persuasion, they're going to take as much of the racism out of it as possible. So find that doctor you can trust, go to the doctor, and get a good understanding of what health is. And I always say vote, 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 and be an educated voter. How you vote can impact your physical and mental health because the laws that the politicians put into place can make a difference in your life. Whatever side you're on, just know that those laws make a difference. And so be that educated voter. I want to thank you for joining tonight. And Dr. Brown Pruitt, thanks for joining us tonight and taking out of
My
your busy
pleasure.
schedule. Would you like to have any closing comment?
I would also say, as a teacher, that there are things that we can do in our institutions. And there are also studies that show that as people learn more evidence, some of the bias drops out of their thinking, which, trickles down to better patient care. So I would love to believe as a teacher that we could teach bias out of our students. So
Awesome. There is an election, another runoff election coming up on June 18th. It may not impact everybody, but I always say you can go to vote411.org and see if there is something you need to vote on. Don't vote just to vote, be an educated voter. Um, Thanks again for coming out. And for all of you who joined, thank you. Oh, and yes, share. If you're on Facebook, hit that share button and share it with your friends. And I totally don't understand how all that works, but share it so that others can have this information. See you guys next week. And always remember, Black mental health is mental health. Take care of yourself.